Should I go back there?
Okay, gavel again. Okay, call the Health Services Committee meeting to order. Can I have a motion to approve the minutes of the previous meeting? Supervisor Runyon, Supervisor Thomas, second. In favor?
Aye.
Opposed? Okay, privilege of the floor. Anyone from the supervisors or from the public have anything they'd like to address at this time for the committee? Seeing none, Dee, I'm gonna start with you.
Good morning, everyone.
Good morning.
Good morning.
Soon to be afternoon. So we do have one action item today, and that is permission to amend our ISIP, which is the expanded in-home services for the elderly program contract with Hamilton County Public Health from $45,000 to $60,000.
I have a motion to bring this to the floor. Supervisor Runyon, Supervisor Gilligan. Questions? Seeing none, I'll call the question. All in favor?
Aye.
Opposed? Carries.
Okay, so then it is time for my budget review. So your first sheet is for Hamilton County. This one here, I don't know if you guys want to go over that. All right, then we have Warren County. I do have some notations of my own because we do plan to delete 2 positions. And then one of our positions is going to be split 50-50 between Warren and Hamilton County. So overall, our total expenses will be $2,409,150. It's going to go down a little bit. All right, and then on to the budget worksheet. Page 1 is Hamilton County. That is what we get in contributions, their share, our federal and our state aid. The next page, kind of right here where it goes to 67722 OFA Warren County. That goes over the contribution amounts for Warren County, which have stayed pretty similar. I did reduce our home delivered meals one by about 5,000 just to be safe, because we've seen the contributions go down just slightly. Then we have our state aid amounts and our federal aid amounts. One thing to note for our federal aid amounts, our NYSIP, the NSIP, it has decreased about 50,000 from last year for just for Warren County. And that is because the amount we are getting from the state has gone down, and that's across the state. So then page 3 goes over our Hamilton County expenses. And then page 4 is Hamilton County as well. The very bottom is where we start with Warren County, and that's our salaries. Again, with this, we should see an overall decrease of about 21,000 in this area because of those changes we propose to make. Then on to page 5. The only major changes with the 400s is that we moved monies from foods and supplies and different items into contracts. And that's because we are now doing the meals for our Johnsburg location out of Warrensburg. So we are contracting with Countryside Adult Home to do the bulk of that. So that's why that money moved there. And then you've got our 800s on page 6. Next up, you've got our salary schedule. On the 3rd page of the salary schedule is where you'll see the 2 positions that are going to be deleted. That's food service helper number 6 and meal site cook number 10. The food service helper number 6 was at our Countryside location. She had transferred up from Cedars when we did that contract with the Salvation Army. And we kept that position until her retirement, and then we plan to delete it. The meal site cook number 10 position was the cook at our Johnsburg location. And that one we are deleting because we consolidated them into our Warrensburg location. So those are those 2 changes. And that's on the personnel request forms. So there's 2 of those. Then you'll see the breakdown of our contracts, just so you guys have those. In the first column, it lists the funding source and the program period. And then underneath that is the vendor or agency that we have the contract with. The second column lists which county the contract is for and whether or not it might be for both. The third column lists the actual service that's provided. The fourth column goes over any specifics, like if we have a per hour rate or per unit rate. Anything like that is listed in there. The total amount of the contract is the next column after that, and then the breakdown between Warren and Hamilton counties listed as well for you. That's 2 pages long. And there's a budget recap, which just goes over those changes that I mentioned with the 2 positions. And then the changes in the 400s.
Okay.
And then, of course, we added in 426, we had the subscriptions that we had to add for both counties for the IT costs. We also added $600 for the food serve software, which helps us do our menu planning. I have the 2005 initiatives, 2006 goals, and then kind of our workload measures. So you could see how many people we served in 2024, and then how many we've served from the beginning of the year until June 30th of this year. So about half of the year. And then the last 2 pages just gives you the tentative allocations of how much we expect to receive from NYSOFA underneath each funding source, and then what is covered under each funding source.
Thanks.
And then it also gives you the amount that we are required to pay. Just the 2 things to note is that the 3C1, 3C2, and our WIN funding, that although there's only a 10% match for those, and for WIN it's 0, we still contribute more because that's our nutrition program. So the county share is higher for that than it would have to be. I'm not sure if you guys have any questions on it.
Anyone have any questions for T? Running?
So SNAP is now called WIN,
Yes.
for the
Yep.
total SNAP program is called?
No,
WIN, or
just in
for
our
this?
agency.
Oh,
Yep.
okay.
Mhm. Yeah, and it was called SNAP like a long time ago, but I still put it in here because in some of the
Prior members.
the breakdowns here, it might say SNAP
Mhm.
as the funding source. Where you see the state and federal aid, it might list it as SNAP, like
Okay,
here it says SNAP.
yeah.
So I put it in there so people can see that, what it should be.
And how did that move from Johnsburg to Countryside go? Is it
It's going
Well-
pretty well. We still have some like staffing things that we have to iron out, like whose responsibility is what. But overall, it is going well.
You said the reduction in donations is lower now?
I put down that it was gonna be lower for the home delivered meals only because we have seen just a slight decrease. Just to be safe, I didn't want to estimate it and then have to come up with more county funding.
Well, Hamilton, wasn't Hamilton up?
Hamilton may have been up, yes. Let me see.
We were significantly lower.
Nope, I did drop the Hamilton 4,000 as well. For it's line 2097.
Right.
That one went down. Some of where it says Hamilton County share, that may have gone up. And that's because I base the actual split for the next year on the previous year. So however many meals we provided, I then figure that out to see how much of the share they should get for the year.
Okay.
And that's for the meals programs only. The other ones we do a 20-80 typically split, unless we are given specific instructions by NYSOFA that we have to split it a certain way.
Okay, anyone else have any questions for Dee? No? Okay, thanks, Dee.
If you guys do have any questions on it later, just feel free to reach out to me and I'd be happy to answer them for you.
All right,
Because I know it's a lot of material.
Thank you.
Rob,
Thank
you're
you.
gonna be next.
Hey, everyone. Anyone not familiar, Harry Carlson is with me. Harry's our Deputy Director Fiscal. And Harry has put together our proposed 2026 budget. So Harry's gonna walk us through that.
Then the first few pages are the revenues that we're going to get from the state, most of them. The one difference, and basically it includes the 2.6% COLA was just awarded in 25. And we factored it out, 1/4 of it factored into 26.
Harry, I'm not hearing you well. Can you get the microphone a little closer?
Yeah, right, one of these, there.
These.
Pull that baby there.
Thank you.
Okay.
Buzz.
Feedback.
I see, that's what you get for trying to make you with yours better.
Yeah, okay. Okay. Okay, the revenue pages, like I said, we didn't factor in the 2.6% COLA. They're calling it a targeted inflationary increase, but it's a COLA. So, and 1/4 of it goes into the 26. We're in the process of amending the 25 to include the 3/4. We did increase the federal salary sharing by $5,000, because normally you get about 25 to 25,000 a quarter for salary sharing, which is basically just our staff's interaction with Medicaid funded programs. And whether that's going to be on the block, with the great new bill that's coming out, I don't know on that. Right. Okay, and then basically, like I said, it's just mostly the revenues coming in from the state, all of it, let's say for the first few pages. Then when we get to the page 4, that's when we start getting into our budget, which again is the first part of it is the salaries, which is just what we do, what we get. But the other than personal services, we had a couple items that we took down or reduced, and we had to increase a couple of them. Basically, I think we ended up reducing about 1,400 between the items. The one new item that we have on the other than personal services is the medical fees, which is related to the medications to the jail services. You can probably say it more about than I do. And that's the first year, and then 25, half of it, and then the second year in 26 is a full 14,500. Then our contracts, that is respite services that we contract to local providers. Probably the bigger one is Waits House. I think that's the one that utilizes that more, I think. Again, the fringe benefits, it's whatever it's calculated out. And then the rest of that, that's just the expenses for each contract that we have. The full amount in 26 is what we anticipated, and then kind of including the COLA. And then, of course, the big one is the criminal expenses, which we put in for 800,000, but that's to be decided, I guess.
Yeah.
I think Rob figured out that's about what on average it is with the last few years, but it seems to go higher every year. I think that's basically it. It's mostly state aid, and with all this is really non-Medicaid, so hopefully, with the exception of the federal salary sharing, hopefully we don't get hit on it, but you never know.
Yeah.
Any questions?
Any questions for Harry and Rob? Seeing none, looking good, Harry.
Glad you had these here for me.
Well. Biggie isn't your fault. I thought. Supervisor Thomas, weren't we looking into trying to find out why this is? So exorbitant now when. I thought, maybe it was the treasurer was talking about looking to see. Yeah, she did look into it. And. And we were looking at why this fee was so high and how long they were keeping each person, because this is really, this is what kills this budget, is that one thing.
There is, the treasurer's looked into it. She's asked the comptroller for additional visibility into what happens. But basically, there are three facilities that we use. I think they run about $1,300 to $1,600 a day. There was a bill introduced to committee last year to try to change, and I don't really know the technical terms like these guys do, but it's not a restorative practice. You're not supposed to restore someone to a certain level of competency. You're supposed to determine simply, are they capable of understanding the charges against them in a court? And if you make that determination that they're not, the goal is not to bring them to a point through counseling or whatever to get to that. You're supposed to return them to the court system and say either they're competent enough to stand trial or not, and then the court has to decide. What's happened in some cases is they kept people longer than most people believe is necessary or required. And that's what the bill was supposed to address last year, but it did not make it out of the committee. So, and that was in the assembly. They think it'll be introduced again next year. There's a companion Senate bill as well. Neither of those were sent to the floor for a vote, so. Thanks. So
Just to comment on the local level, I'll be getting together with Greg Canali and Jason from the DA's office. And we are going to be looking just locally, taking a look at it. Is there anything that we can do locally within our own criminal justice process and system to try to divert some people or reduce the expenses?
Well, I think the question has been, why is the length of stay so long? Why does it take them so long to get to that resolve of where this person should be? Just like the administrator was saying, I don't know if there's anything we can do to put some question or put some pressure on the assembly and, see if we could get them to move this a little quicker and see if we could get some kind of resolve, because this is very high, and I think everybody agrees, it kind of hurts as the county in a whole, and you don't really even know how many people are using that defense, so I guess there's a lot of questions that we'd like to know, but the big one is that the state wants us to do this and they should start giving us more money.
I'd just like to add, and the issue really, and the treasurer showed, she had a graph that showed exponentially how much this has increased, but primarily what happened until about 4 years ago, we were only paying half of the cost associated with the person while they were in the facility. About 4 years ago, the state decided that we would pay 100% of the cost as opposed to 50%, and that's where we got a big increase. I also just wanted to add, we had a long discussion about this at the County Administrators Forum at the recent NISAC, and NISAC attorneys, the folks on staff, are not optimistic that we're going to see any movement on this in the near term. So.
Supervisor Bruno?
But even having said that, 4 years ago, we were paying 50%.
I don't know the exact. I think
Well,
it's
roughly,
about
okay, so my point is this, even at, going to 100%, 4 years ago, the costs were nowhere near this. So that begs the question, what happened? Where did the increase come from? Because again, if you take 4 years ago and we had to pay 100%, it would have been in the what, tens of thousands of dollars, not hundreds of thousands? So something,
So we've
What's that?
looked at we have looked at the numbers for this, and what happened is not only did what John just described, the split from the 50% county to 50% state shift to 100% county. We also saw our numbers of people about double, and also the per diem charge over that time approximately doubled. So it was kind of a combination of all these factors that drove the costs up so high.
and who determines the level of competency, if you will, of these people? Who is that?
So the initial question comes from the court. At some point in the court process, someone raises the issue, is this person competent? Then the court orders everything stops at that point in terms of their process. We receive an order to arrange for 2 examinations, and we use local psychologists for those in the community. We pay, I think it's 175 per exam per hour for the exams. So those 2 psychologists then submit reports to the court. They do an examination and submit reports. If they disagree, sometimes there's a 3rd examination order, so which we would use another psychologist. And then if the person is determined to be not competent, if they have felony charges, that's when they go for this process, the restoration process.
So if we,
But then the state, that's a state facility, so then the state determines when they're competent, ready to return to their court process.
does anyone compare the numbers now with the numbers, say, 4 or 5 years ago? Of people that were deemed incompetent, requiring,
Yes, our number's about double.
Yeah, we used to budget between 25 and 50,000.
right?
Sometimes we didn't use that.
Yeah.
Years.
Supervisor Runyon?
So everyone that is in that program is up for felony charges?
The ones that we incur an expense for, yes.
Yeah.
If you have misdemeanor level and you're found to be not competent, then your charges are dismissed and you're sent to a civil facility where there's no charge to the county.
Thank you.
Okay, any other questions? Supervisor Thomas?
Would it be possible for the county or a group of counties to do their own competency?
That's one of the things that's been
So-
talked about is that, you know, at one point, the state was advocating that counties could possibly develop jail-based restoration. But that was really before the bail reform. So now we see most of these people are not even in jail. So they're out in the community and so could we develop a community-based restoration?
Right.
Maybe, but again, it's something we would have to work with both the state and with the DA's office on because you know, the DA's office would have to agree the person would be out in the community. You know, it's safe to be in the community and be in that kind of a program.
Right.
But that's some of those things we'll be talking about between Jason Carasone and Greg Canale and myself.
Well, hopefully we can get a handle on it. It's a little exorbitant,
Well,
yeah.
And just to add to, the State District Attorneys Association is not in favor of the legislation and they've arguing against it,
Against,
against any reform. 730. These are the civil, CPL 730, civil something law, right? Procedures law.
okay, any other questions? Okay, thanks, Rob. Thanks, Harry.
Thanks.
Here, they're waiting for Janelle.
The other point on that, while we're just the treasurer wrote a really well-constructed note to, the comptroller's office asking for transparency, and it was never responded.
Well, anything that the state's gonna have to spend more money on, and they're not gonna just probably respond to us. That,
Does anybody need an agenda?
No, I have one.
Thank you. Anybody need an agenda?
Thank you. Budgets. Yeah, it's just that, you know, it's shorter, it's as long as.
appreciate that.
Save some money on all the paper clips.
Agenda.
Okay, Janelle, you all
Yeah.
set?
Yes.
Lead us on.
This one.
Nice, yeah.
Good morning, everybody. We're here representing Health Services. Our first resolution request is to amend our Health Services Table of Organization and reclassify the principal clerk grade 7 title, which has the annual salary of $55,675, which will be deleted to the senior account clerk number 4 grade 7 title, which that annual salary is the same, which will be created and filled by the incumbent at the current longevity and step. Health Services has been working with Human Resources to better align the title to reflect the incumbent's fiscal related tasks. The employee, the direct supervisor, the director of Human Resources, and the director of Health Services are all in agreement this is the best way to proceed. This change is budget neutral. It better reflects job responsibilities. It streamlines our organizational chart. And it provides a table which is the same, or a title, which is the same as those in the department doing the same type of work. And just to clarify, the reclassification is zero budget impact.
Okay, can I have a motion to bring this to the floor? Supervisor Gilligan, Supervisor Runyon on the second. Any questions? All in favor? Opposed? Okay, number 2.
Our second resolution request is to authorize the chair of the board on behalf of Health Services to accept and enter in the FFY 2024 WIC General Infrastructure Grant. The contract number is listed there, and to receive federal funding in the total amount of $2,613 for the term of October 1, 2025 through September 30th of 2027, and the amount of $1,306.50 per grant year, and to accept any additional funding and authorize any related amendments and or extensions in a form approved by the county attorney. This is a federally funded grant award, and it's intended to support the enhancement of technology used to provide WIC benefits and services, to provide better use experience for the WIC applicants, participants, and staff that will improve the longevity, flexibility, program integrity, and cost efficiency by increasing the use of plain language to support individuals with limited English proficiency.
Okay, can I have a motion to bring us to the floor? Second. Supervisor Bruno. Any questions? Okay, we'll call the question. All in favor?
Aye.
Opposed? Okay, carries.
The next 3 requests are related to budget amendments, so I'll turn the floor over to Ton.
Resolution 3 is the one Janelle was just talking about for the $1,306.50 for the WIC program, half of what we're gonna be getting over the next 2 years. And we wanna put that in, and one of the things we just, like she emphasizes, we're using a program called Language Line, which is a phone that connects them so they can talk to people who don't speak English. And it's been great. We've used it for at least 4 or 5 different languages, so that's worked really good. And so we're gonna offset it with this grant. That's what that's for. That's attachment 3. Does that need to
Do
be-
these all together.
Do it all together? Okay. Attachment 4 is to amend the budget for the For the early intervention program, again, we're getting an additional $2,366, again, hitting revenue and expenses with that. And attachment 5 is our, passenger,
I'm sorry.
is
Throw them all together.
yeah, they're doing them all together, is the child passenger car seat. And, I just want to emphasize that we already told that we've done a really good job, and they already need to get more car seats. Infant car seats is the big thing, I guess, that they've actually run out of them all, so this will help once this is in the budget, and they can go and purchase those. So that's worked out really good.
Okay, can I have a motion to bring 3, 4, and 5 to the floor? Supervisor Runyon, second Supervisor Gilligan. Any questions?
Is there an objection if we do those all as one resolution since they're all budget resolutions?
These are all budget amendments, so it's all on the resolution that we do.
Okay, call the question. All in favor?
Aye.
Opposed? All right, number 6.
Resolution 6, which just to point out is attachment number 13. This is to authorize the chair of the board to execute a contractual agreement with the State Health Department and Health Research, Inc. The contract number is listed for the grant period of a correction, July 1st, 2025 to June 30th, 2026. In the amount of $52,099, and to further authorize the board chair in a form approved by the county attorney to amend, extend, renew, and accept additional funding, and to enter into future New York State Department of Health Emergency Preparedness non-competitive grants. There's a previous resolution there, 312 of 2024. Health Services has utilized the State Health Department grant funding to complete required deliverables to promote planning and preparation for emergencies. Annual contracts are anticipated each year, and the board chair, we're asking to have the authority to authorize additional funding amendments, extensions, renewals, and to enter future contracts to receive State Health Department funding if more funding becomes available, just to make the process more efficient.
Okay, can I have a motion to bring it to the floor? Supervisor Runyon, second Supervisor Patchit. Any question? Okay, call the question. All in favor? Opposed?
Thank you. Number 5 is discussion items. I'll turn the floor over to Ton for her report of revenues and expenditures, and also the comparison report.
Attachment number 6 were our financials as of September 10th. Note that regarding salaries, which is a big part of our budget, that we are at 58.09% of the budget as of September, where last year at this time we were at 66.22%. So we're doing fairly well regarding that, and regarding comparisons on attachment number 7. Again, it's the salaries, equipment, most of the equipment has and how our offices have been all pretty much, I think, with phase 3. And our contractuals, again, it's just due to timing. We just got through summer school with preschool and EI, so hopefully those expenses will be reflected in the next month. And employee fringe is based on, any salary increases and everything regarding revenues are comparable. We are in the process of closing August for our healthcare. So that's where we stand.
All right, next we have our overview for our 2026 budget, not the 2025, which is your attachment number 8. And I handed out the highlight page in the budget summary that we'll review, and if you want us to go into more detail, happy to do that. Just kind of as a start for the 2024-2025 accomplishments, our agency successfully secured funding and implemented our 2024-2025 child passenger car seat program. And we recently just received approval for the 25-26 grant funding, which will give us the second year of funding, which that program's really taken off. Our second accomplishment that we wanted to highlight was successfully cross-trained public health program staff, and demonstrated that creatively sharing our staff from other programs enhanced our services, addressed our demand on staffing needs, and also saved money through the payroll distribution. So that's worked really well. We provided harm reduction outreach and education, including collaboration with the Healthy Alliance for Narcan distribution. We've increased outreach and education programs to the community. This includes our Lyme disease education and tick reporting system that was created last year. That's been really utilized by the community pretty well. We've had a successful New York State Department of Health home care survey in June that validated the experience and expertise of our nurses and the skilled and quality service that they provide. We're very proud of them through the survey. The other accomplishment we wanted to highlight was we utilized the infrastructure grant to renovate and furnish our health services office, and that was a zero budget impact. Our goals for next year are to hold our budget to our 2024 actual profit loss while comparing the 3.25% raises and increased program expenses, and I think we successfully did that, at least in our request. We want to complete the office renovations with our infrastructure grant with the remaining funds that we have there, which is anticipated to not impact our budget. We want to retain and recruit our contract therapists and continue to focus on filling community gaps by delivering high quality care. We want to create and implement our Jewel outreach and education programming throughout the community, utilizing the Jewel Settlement Award, which we finally received some payments for. And we want to explore creative opportunities to provide and service training and education while fostering collaboration, strengthening the health services team, and a plan for succession, which also will have zero impact funding. A quick overview of our programs, our home care agency, aka CHA. In our budget, you will see that we saved $91,517 by deleting one vacant public health nurse position. With our contracts, you're going to see that we're basically increasing around $35,000. That's mainly to help boost our therapy salaries to be able to retain and recruit our therapists. Our CHA reimbursement, just to give you a snapshot of where the money usually comes down, it gives you the traditional Medicare breakout, the managed Medicare breakout, Medicaid, etc. And then what Ton always likes us to note is how much of our CHA budget is retiree help, and that's around $164,601, which is 19.01% of our CHA. In the preventive program, we get a state aid grant, and the base grant is $577,500. And then anything above and beyond that that's eligible for state aid, we then get reimbursed at 36%. Our WIC program is a zero impact program. We receive a grant of $545,500. We're continuing to, save money by sharing staff with other public health programs. We're also able to put in some indirect costs, which covers Ton's time, my time, and our supervisory time. And that usually generates around almost 48,000 in revenue. Our family health program, we have one grant basically booked in that program of $56,472. It's the Children Youth with Special Healthcare Needs program. There really aren't that many expenses above and beyond that, but if there are, then we would cover those with state aid funds because they'd be eligible for that. For our disease control program, which is a mandated program, we're saving around $18,000 by reducing our per diem salary expense by $10,000 and reducing our overtime expense by $5,000. We had beefed that up a little bit after the pandemic, just kind of not sure where things were going. And at this point, we feel pretty comfortable lowering that down a little bit. Another thing that we do is we do payroll distribution to Countryside by collaborating with another department. We provide nursing to help do blood draws and some other basic needs, which actually saves Countryside and it saves our nurse time by sharing the staff. And that's been successful. We also do patient review instruments, which are considered PRI and screens, and that's a revenue of around $300 a screen. We use our public health nurses for that, and that helps offset some of the expense of the nurses. And then the grants that go through that program are the lead, which is around $37,000, our immunization program, which is around $33,000, and our rabies, which is around $17,000. Just to note, and just this morning, Ton was battling the state health department, advising them that that's really not sufficient to cover our rabies related expenses, even though we really do a good job in that program. What money comes out of there is the vaccine money, the money to do the rabies clinics that we're required to do, but also paying the share that the insurance doesn't pay when people have to be treated for rabies expenses or rabies treatment. That pile's getting bigger and bigger. Summer's a busy time. August is a busy time. Ton has a stack on her desk that she's going through to get reimbursement for. But I will say that when that rabies grant is gone, which we are through already, and we were advocating for more money, those are eligible for state aid expenses at 36%. But it does look like the state's gonna look at how many average rabies post-exposure treatments are happening per county, and then they're gonna try to make a better reallocation for
That's good.
that money going forward. But that won't affect 2026. That'll be more 2027, I think. As far as health education, this program's exploding, which is a good thing. You want us out and about in the community, doing prevention, education, outreach. Our big task, required by state aid is the community health improvement plan. Our two focuses are chronic disease and mental health. We also do a lot of education and outreach from little daycares all the way up to our seniors that are senior sites and meal sites and different programs, senior centers. We do other health education programs for community groups, senior schools, daycares, which I kind of just mentioned. We do tick and tick-borne diseases. We do the tobacco, vaping, substance abuse, marijuana education, and then opioid prevention and Narcan education. One of the places we're expecting or hoping to grow is to get another person or two trained to be able to offer CPR classes, because that is revenue generating. Right now, we booked 2,000 estimated revenue, but if we can have more instructors, there's definitely a higher demand. We could be doing that a little bit more. Everything above and beyond, again, this is a mandated program, is state aid reimbursable. Our bioterrorism emergency preparedness grant is zero impact. Doesn't go far with 52,000. That's pretty much your staff and fringe, and then some, but the extra expenses are state aid eligible. Our early intervention program is a mandated entitlement program serving 0 to 3-year-old children. I put in there a few statistics. Just in 2024, we had 184 referrals. All of those get evaluations that we have to pay for. And of that, and you have the kids that are already in the program, so that's why that number is a little bit higher, but we served 198 children in that program last year at an average of $3,737.99 per child after reimbursement from other measures. The way we get reimbursement for that program is we get Medicaid reimbursement. We get EI administration grant reimbursement around 38,000, and our expenses that are outstanding are also eligible for 49% New York State reimbursement, but that program is still very expensive and falls short, as Tawn will share with you when she gets to her portion. Our preschool program covers children 3 years to 5 years. It's also called the Committee on Preschool Special Education, or the CPSE program. I gave you our numbers for that program. As you can see, we serve 397 children in that program at an estimated average cost after reimbursement of almost $6,000. The big piece of that is transportation. The good news this year is our vendor agreed to continue at the current rate versus us having to go back out for RFP, which always means more money. So we were able to successfully negotiate them to stay the same. And the reimbursement for that program is also Medicaid, in addition to 59.5% reimbursement, and then the rest is on the county. Our public health infrastructure grant that you've heard us talk so much about, that's a 5-year grant that started December 1st of 2022. We've been using that for our renovations. Everything we do has to have our budget approved by the state, and that is a zero impact grant. And we still have money there that we're going to be using for staff education and training. Our Governor's Traffic Safety Committee is a new thing that started last year, and again, we got a 2nd-year funding for that, so that's good news. Everything has to be pre-approved that runs through that, but that's a zero impact grant. Our Jules settlement is also zero impact, but that's given us a lot of funding to do outreach and hopefully prevention on vaping. And I put the money there that we've had, and with that, I'm going to turn it over to Tawn who will review our nice colored spreadsheet with you. And then if you want more detail, we certainly can go into that if requested.
One thing I just wanted to add to, when she was talking about the early intervention and we get 49%, we just got notified yesterday, we're gonna be getting $118,000. That's paying from July 1st of last year to December of last year. That's how far behind they are with payments, just to give you an idea. So anyway, this is a summary of our budget that we submitted this year. On the left-hand side are all of our different departments that we go into that make up our everything. And what I just wanted to say, I don't know if you want to go line by line or just want to see the total, but the yellow is just telling you, like Janelle just said, who are the mandated programs, our preventive program, our disease program, our early intervention, and our preschool, which are, I mean, those alone add up to $5.3 million. Those are mandated programs, nothing we can do. We have to offer those with our public health. Going over across, if you go over to the pinkish area that you can see all the way at the last, you'll see the 2024, what our actual impact was to the county was a loss of $3.5 million. And this year, we are budgeting for our loss for the 2026 to be 3.382,700, which is the third over, I guess, with the little yellow columns that will tell you that's what we're budgeting for at this point. So we are coming under what we actually did last year. We did the column with estimated payroll adjustments. It's the first pinkish column for 146,125. That's our impact that we're asking for, and reduction for salaries, the one position, and reducing, like we said, overtime and some part-time stuff, and that, so we are reducing those salaries, and after those are taken into effect and how they would affect state aid is, like I said, a $3.3 million deficit. And I want to emphasize, like the preschool program is the impact of that alone is 1.4 million of that. So almost half of what we're looking at is what we're expecting, or 1.3, I'm sorry, no, 1.4. And that's what we're expecting, and that's the norm with both of those programs, because we only get 49% on the dollar for EI and 59.5% of the dollar on the preschool program, and they're mandated. So there's nothing we can do. And again, that could go up or go down depending on how many children we have in the program. So we have our best guess with that one. And it gives you an idea. You can see we budgeted 1.4 last year. We did 1.8 of loss for preschool and early intervention. We're budgeting 540,000 and we did 591 last year. So, right now, and the therapist increase that we were talking about is more with our home care. They're set by the state for our preschool and early intervention program. So that's not going to affect them. That's only going to affect our home care therapists that we struggle with trying to get therapists in all three programs trying to get. But that's a summary of all our programs to give you, goes line by line across, tells you what we look for each one. And then, like I said, the last three columns will give you a comparison, or last four, of where we stood last year and where we stood with the budgets last year and where we actually hope to be for our 2026 budget.
Okay, any questions for Janelle or Tom?
Very nice job.
Well, seeing none, nice job. Appreciate all the hard work you do for us. It's quite definitive here, so. Mr. Patch, you have a question?
No.
Oh, all right. Okay, so you guys are all set. Thank you very much.
Thank you.
Now I need a motion to adjourn.
Oh.
Supervisor Patchett, second Supervisor Runyon. Okay, we're adjourned. Thank you.